Well, good afternoon, ladies and gentlemen. It is an honour and a privilege to talk to people like you who value the NHS. I just wish, however, I'd been the first speaker, because following the previous two speakers is really a huge challenge. I found them extraordinarily moving, and actually it's reminded me why I feel so angry about what's happening to the NHS. You are prepared to fight to protect it against the predators who are circling around it. Predators who see human suffering and illness as an opportunity to make a quick buck or a quick $1 billion. Now, I'm speaking to you as a doctor who worked in the NHS for nearly 40 years, and as a patient, as the father, husband, and indeed son of patients, and as someone who, with many others, including those in Keep Our NHS Public, 38 Degrees and so on, are fighting to defend the NHS, to defend a publicly provided, publicly funded service, free at the point of delivery, available to all, irrespective of the means to pay. Now, this is a service that until now has cared for rich and poor, young and old, without discrimination. It is an expression of our deepest values, that we shall care for the needs of others, that we shall recognise our fellow citizens as brothers and sisters. It represents our values at their best. No wonder the smarmy Barrow boys who are currently in power in the government, the Tories and their coalition fellow travellers and useful idiots, hate the NHS. They hate it. They don't get it. They don't understand an institution built on ideals of a nation that is a true community, motivated by care for our fellow citizens, and most of all, by the noble principle of sharing risks in facing the lottery of life and death, of health and sickness. Cameron and his cronies and his big business supporters don't get it. But they are dimly aware that the British people do get it. In a recent survey, over 80% of the population opposed the privatisation of the NHS. So this being the case, how in a democracy did we get to this point? How did we get to a situation where services for people with cancer, which you've heard described brilliantly and movingly, and people requiring end-of-life care are being sold off to multinationals, many of them the United States, and many of them with very, very dodgy track records, their concern being only to make a profit? How did we get to this place? Well, I can tell you how we got here. Lies, myths, and deception. The Tories lied when they said they were not privatising the NHS, and we now know they are. They lied when they said that privatisation is just scaremongering. I'm sorry to tell you, this is actually truth-mongering. The rate of privatisation has increased fivefold between this year and the last, £6 billion and counting. The NHS is melting like a polar ice cap. They lied when they said that privatisation would benefit the NHS, when we know that international comparisons show that the NHS is the best health service in the world, according to all the criteria that really matter: quality of care, access to care, safety, and value for money. We know also that privatised health services provide terrible care to those who cannot afford adequate insurance. Think of the United States, which spends twice as much on healthcare and has the worst healthcare results in the developed world. That's private healthcare for you. They lied when they said that competition would be good for the NHS. I could give you very many examples of just how bad it is, but let me give you one particularly sickening one. Last year, Poole and Bournemouth NHS trusts decided that they would work better if they pooled their resources and became a single trust. It would save millions of pounds and would have all sorts of other benefits. For example, consultant cover for A&E, 24 hours a day, 7 days a week. It was supported by all the clinicians, by the managers, by the public. But Spire down the road raised their finger and said, hang on a moment, this is anti-competitive. You're actually plotting against the services we're offering. We're going to be squeezed out. They challenged this decision and brought the merger grinding to a halt. Poole Hospital facing debts of £14 million and a legal bill of £6 million. You see, the Tory dream sees cooperation for the benefit of patients as merely anti-competitive, and that it threatens the profits of their friends, and it must be stopped. I am not, by the way, a swivel-eyed left-wing Trotskyite. I can tell you I'm slightly left of centre, but I've been radicalised as a result of what has happened over the last 5 years. So, ladies and gentlemen, as the NHS is torn apart into pieces gobbled up by the privateers, it will disintegrate when we need ever closer integration. We will get less care for more money, there will be increasing rationing as the privateers pick up and drop bits of your NHS as they wish. Think what happened to eye care in Taunton. Think what's happened to the GP services in Cornwall and Newcastle, where the privateers decided they weren't making enough profit and dropped it, leaving a big mess behind to be picked up by the taxpayer. And remember above all, Hitchingbrook. You remember how Circle were going to solve the financial problems of Hitchingbrook Hospital and how they were going to improve the care available? Well, they've just dropped that contract, leaving it in financial mess and of the worst Care Quality Commission report that has ever been passed on a hospital. So thank you for being here today to fight the biggest and most disgusting sell-off of all, the sell-off of cancer and end-of-life services. This is a historical moment in our fight. We have a chance next Thursday to kick out the Tories and call a halt to the sale of the NHS. And if Labour gain the balance of power, we can then hold their feet to the fire to make sure they deliver on repealing the Health and Social Care Act. And if we don't fight, people will start dying for lack of care, and certainly they will suffer for lack of care or be financially ruined trying to pay for the care the state no longer provides, care they cannot afford but desperately need. So, ladies and gentlemen, don't let the fat cats steal your NHS. Don't let their chase after profits crush your values. Don't let their greed write your death sentence or that of your children. Thank you.